911, what's your emergency?
My kid fell through the ice, eh? He's all blue, eh? He's playing hockey out there on the ice. He fell through, eh?
What is your location and how old is the patient?
It's at Little Lake, about 2 clicks north of the old Pines Mill there, eh? He's my 7-year-old son, little Dougie McKenzie.
Is he breathing?
Hey, Dougie, you breathing? Hey, wake up, Hoser. Hey, Hoser, start breathing there, man. No, he ain't breathing, eh?
Okay, sir, we'll be dispatching units. Please stay on the line.
Okay, step on it, eh? He's over here, eh? Come on, breathe, Hoser, breathe.
Sir, you need to settle down. Tell me what happened, okay?
He fell through the ice there, and I drug him to the side of the lake, eh? And he's not breathing or nothing. I took his clothes off him so he'd get warmer, eh?
Okay, how long ago did this happen?
Gee, I don't know. I called the 911, eh? Don't they take the time there?
You need to let us know
I
how long
don't
ago
know.
this happened. How old is your son?
He's 7 years old, eh?
Okay.
Yeah, just his birthday last week. We had this big cake for him, eh? It was really nice. We all drank a bunch of beers and got drunk, eh? And it was a good time.
Okay, quiet. I can't hear this.
Okay.
We need to work on your son.
Sure.
Okay, blood pressure 75/40.
Okay, and respirations were 10.
You know who's winning the Canucks game, eh?
Sir, you need to back off.
Oh, geez. Hoser, start breathing, man.
Temperature is 92.4.
Pulse is 50 and irregular.
What's that mean, eh? Is that good?
It means that it's 50 and irregular.
Is he dying, eh?
Sir, he's not dying, but we need to get him into the emergency right now.
Okay.
So this is little Doug McKenzie. He's 7 years old. He was found on the side of the lake. He had been skating or playing hockey, fell through the ice. His father, who was all panicked, said that he had been under the water for approximately 5 minutes. Pulled him out of the water, brought him to the side of the water, and called 911.
He was unresponsive at the time. The vital signs that we got when we pulled him out, his blood pressure was 75/40. His pulse was 50 and irregular. His respiration rate was 10, and his temperature was 92.4. He was not shivering.
So for culture and socioeconomic status, pretty much McKenzie on the McKenzie scale.
Yeah, they're very McKenzie.
Okay.
Yeah,
I
there's a little bonfire going there, and she's hanging around.
Okay.
Any alcohol on board with
not
him?
on the child's breath. No,
Great.
didn't get any of that. But,
Cool. Well, should we start our assessment?
Yes.
Thank you.
Mm-hmm.
Thank you. Good luck.
All right, so I'm going to get these electrodes on him.
We're going to take his
Get
temperature.
an EKG going. Alright, that looks pretty good on the monitor. Good. Good, he's still a normal sinus, but he's real Brady.
Okay. Temperature is 93.5.
BP is 78/46.
How do his lungs sound?
So he's got an irregular pulse rate at 60, and then he's only breathing at a 12.
Okay.
So I'm going to check these IVs, make sure they're still patent.
I hear diffuse throbs and wheezes bilaterally in his lungs.
Both these IVs are patent. We warmed up the fluid, so
Okay.
he's got warm fluids going.
Great.
And then I see the doctor also ordered a lavage. I'm going to get that
A gastric
started.
tube, wonderful. Okay. So at the same time, we need.
Hey, Dougie. Hey, Dougie.
How do his eyes look?
They're pretty sluggish. And then the doctor ordered that warming light. Will you bring it over?
Oh, yes.
Great.
All right, Dougie, this is a warming light.
Okay, Dougie. Swallow. Swallow.
Good job.
Swallow. Confirm placement.
Mm-hmm.
Will you push a little air into that? Oh yeah, that sounds good.
Yeah? Yeah. Okay.
Get this going.
Okay.
Good. That's flowing. Awesome.
Okay, so some other diagnostics that we want to get. We want to get ABGs,
Oh, okay.
CBC,
Great.
electrolytes, and we want to monitor his kidney function, so let's get a BUN and creatinine, and serum amylase as well.
Good. I got the
All
tubes
right.
here. And now, have you seen his father around?
I have not.
I hear him around.
Yeah, no.
Hey, where's my kid, eh?
Okay.
He's out in the hall.
I'm gonna go
Okay.
talk to him.
Okay, go check on him.
Hey,
Hi there.
Hi, looks like you got some labs back on your patient here. Another
Okay.
McKenzie boy fell through the ice, huh?
Yes, he did.
Well, how's the temperature doing?
Temperature's coming up a little bit. It's right now 95. Last time we took it.
Okay, that's great.
Mhm.
We got back his CBC. It doesn't look like he's got any worry for DIC.
Okay.
We did, his ABGs showed respiratory acidosis. His pH was 7.2, and his CO2 was 54, his bicarb was 26.
Okay.
So I want to start getting ABGs Q2 hours. And then if we could also, it looked like his kidney function might be a little impaired. His BUN was 18, and his creatinine was 0.3. So if we could maybe start running a BUN creatinine every 4.
Okay.
But I think that's good. How do his lungs sound?
Last time I listened to them, they still had bilateral ralls and wheezes.
Yep. Sure enough.
Okay.
Great.
And then we've had some trouble getting a good pulse ox on him because he's so cold.
All right.
And then so
Sure.
I'm just not sure how you want to manage that.
Do we just want to monitor ABGs?
You know, he's on that warm humidified oxygen. So I think if we just do the ABGs Q2 hours, obviously look for cyanosis and stuff. His hands might be getting warm enough you could put a pulse ox on him now. They don't look too blue, but just keep trying with that. I think ABGs is fine.
And then how many more lavages do you want to do?
I think he's up to 95. I think we can probably quit with lavages. I'll put an order in to see those. All right.
All right, thank
Doc.
you.
Yep. So what's going on with my kid, eh?
Well, he's looking a lot better, Mr. McKenzie.
Okay.
His blood tests are looking better. We did an ABG.
What's an ABG, eh?
No, it's not an ABGA. An ABG.
Hey, okay.
No, not ABGA. ABG.
Okay, ABG, eh?
Not ABG, okay. It's ABG.
Okay.
Okay. So his pH is 7.35, and his CO2 is 44, and his HCO3 is 30. So it's all looking a lot better than it was when we saw him at first.
Okay. I don't know what that means, eh? But I only did like 7th grade math, eh? So.
Well, yeah, it's basically measuring the oxygen and the blood and all this pH and how the blood looks.
Okay.
And it's called an ABG.
Does it look okay though?
It's looking a lot better.
Okay.
So, we got some tubes and stuff going in them. I'll explain some of the things that the doctor said, just to sort
Okay,
of...
yeah, you got lots of tubes in there. He's like, you got the hoses all over. It's like a mega hoser, eh?
Yeah, kind of like a mega hoser.
Okay.
And I'll get this one out so he can just go back to being a straight hoser.
Okay, yeah, get that out of there, because he's kind of a little hoser anyway, so, You know, I don't think he needs all those.
No. Okay,
Okay.
that's done. So what we were doing with that is we were warming his insides with a lavage. We had some warm tubes in there.
A lavage? Is
Yeah.
that like a French thing? Is that from Quebec or what?
Yeah, I think they just started that in Montreal.
Oh, okay.
That was where that came out of,
Out
for
of
sure.
those Canadians, man, I tell ya.
Yeah, especially Montreal.
I know,
Good
yeah.
thing you didn't lose them a couple of years ago.
Yeah.
That would have been a shame.
Yeah.
So, so he had that. That helped warm him up. Those fluids over there helped warm him up. We're sending him upstairs. It's kind of a watch and wait thing.
Sure.
You know, when you swallow that much water, it's tough. It's tough on your lungs. Have you ever gotten a bunch of fluid in your lungs and you're coughing?
No,
and
I had
stuff like that?
well, you know, I had the one time I was we was chugging coconuts down at drinking holiday, and you know, I was on my 6-1, and I got a little in the back of my throat, but you know, I handled it okay.
Yeah, but he got a lot of fluid in his lungs.
Okay.
And we are worried. We are worried about an injury to his lungs. That's called ARDS. Okay?
ARDS?
Acute respiratory distress syndrome.
Okay.
So we're going to need to watch that for a couple days. You know, he may be fine and playing video games or playing hockey or something like that up and down the halls upstairs.
Yeah.
Oh,
If he's a forward, they need him back on the ice. You know.
Yeah.
Yeah. Okay.
He's a forward.
Yeah. Left winger, man. Good kid.
Nice. I thought the Murphy boy was a forward.
No, Murphy boy subbed in a few times. He's like third string. He's kind of a bench warmer though. That Murphy kid, he's no good.
Okay, we'll take extra care of him.
Okay, good.
We got to win at state.
Yeah, sure.
Or,
right. Yeah, it's province.
Province.
The province.
Sorry, I moved up here recently.
Yeah, you're from Michigan, right?
Yeah.
Yeah, well, you know, can't blame me for being a Yank, but
as close as we could get before I got up here.
Sounds good.
So, his ARDS, you know, so we covered that. We're moving him upstairs. We're worried about kidney failure too.
Sure, yeah. The doc says I got, is that kidneys or liver? Oh, maybe it's my liver. Yeah, from the drinking.
Oh.
He says I got to cut back to 2 coconuts a day.
2 coconuts a day?
Yeah. I think he means half racks. Is that right? Like,
that'd
be an even case.
You'd have to check with your doc, but yeah, that would make sense. With drinking, that would probably be your kidneys. And 2 half racks might be a bit much. You should probably.
So that'd be my kidneys then.
No. That's your liver.
Oh, okay.
And we're worried about his kidneys.
Okay, gotcha.
So what happened? You know, he was under the ice for a while, right? And then he had no oxygen down to his lungs.
Sure, yeah, he wasn't even breathing when we pulled him out.
Exactly. So his kidneys took a shot.
Okay.
Kind of like a cross check.
Right, like you know, if you're taking one for the goalie.
Yeah.
Right.
Exactly.
Gotcha.
Exactly. So we need to watch his kidneys. That's why we're going to be keeping these tubes in him. And
hey, this is my son on the line here. This isn't funny, nurse.
You know, I think he's adorable, and I think
okay.
he's probably
I just saw you laughing over there by the cupboards a few
No,
minutes ago. So okay.
No, not laughing.
All right.
So so we're watching his kidneys.
Okay.
We need to keep a close eye on them. And then another thing we're watching for is DIC. Okay.
Okay. But hey, I'm an adult here. You don't have to spell things out for me. If there's something wrong with his little hockey stick there, you can just tell me.
Oh, no, DIC? No, DIC is, that's an acronym. You know what an acronym is?
Sure, yeah, that's like where you use letters and stuff.
Yeah.
To confuse the normal folks.
Exactly,
okay,
exactly.
Yeah.
So, we're worried about him clotting and his platelets and his blood, you know, so he can either throw a lot of little clots, you know, little things to stop bleeding, or he could just bleed out at any time.
Oh boy, that's not good.
So that's bad. And
yeah.
So that's what we're watching. I don't mean to alarm you, but when a kid, you know, takes a shot like he took, we got to keep an eye on it, and that's partly what we're doing.
Well, do whatever you need to, doctor.
Yeah. So someone says DIC, not about his little hockey stick, it's about his blood.
Well, I don't know if you just want to go call it a little there, but okay. Slapshot.
Mr. McKenzie! Mr. McKenzie!
Yeah, hey.
Hey, you need to stop.
You can't stop me.
Okay, I'm going to have to call